Welcome to Wildcat Wonder, where we take you inside Arizona research. Breakthroughs, discoveries, and advances happen so often at the University of Arizona, it can be a challenge just to keep up. We'll handle that for you. Join us as we explore the research, innovation, and awe-inspiring work making a societal impact that maintains the U of A's reputation as a global leader. On this episode, meet Melanie Hingle, a nutrition scientist, public health researcher, and community interventionist. Her work focuses on behavioral risk factors and lifestyle interventions to combat obesity and type 2 diabetes. A member of both the Arizona Cancer Center and the Bio5 Institute, she is passionate about improving access to healthy food and empowering communities to lead healthier lives. If that sounds like a lot, please know this 2023 Women of Impact honoree is a big advocate for work-life balance. Our hosts are Lisa Romero, Associate Vice President of Research Communications and Marketing, and Laine Kowalski, Student Writer and Content Specialist. Now let's turn it over to Lisa and Laine.
Hi, Melanie. Thank you so much for being here. And our second podcast. It was really funny when we were brainstorming people to have on. We were thinking about themes and holidays and kind of related things, and we thought about Thanksgiving. And for some reason, I thought about you as we're entering into Thanksgiving season. One of our more gluttonous holidays,
food, nutrition.
Nice, exactly.
Okay.
Yeah.
Connection.
Yeah. And I mean, I guess I'm just going to break the ice right here and say, as a nutrition scientist marrying Thanksgiving, what are some of your go-tos?
Oh.
What are you looking forward to next week?
Already thinking about it. So for sure, pumpkin pie.
Oh, good.
Absolutely. Which is actually nutritious if you think about it. You get the vegetable part of it. Maybe not so much the sugar part, but the vegetable, and you can make it healthier with some whole grain crust and some nuts in the crust. That's definitely one of my favorites. I love vegetables, so the Brussels sprouts and all the salads are a big thing. Yeah. And gravy. That sounds really bad. That's not a nutritious thing usually, but
how do you do turkey without gravy?
I know gravy, just very basic stuff. Yeah.
Oh, good. Well, I feel a little better about
me too.
what we're planning for Thanksgiving now. So thank you.
Thanksgiving is a time to eat. So
it is absolutely enjoy with family and friends. All those people.
Well, and I think that's something we really want to get back to on a serious note with you is finding that balance, because I think that's the key to trying to be healthy and have nutrition and exercise, but realizing life.
Yes.
Life is life. So we want to get back to that. But another thing I learned about you and sort of preparing, I did not know you were a student worker in the lab here in the 90s. I can relate to the early 90s college days. So talk about how that happened and kind of then how that maybe that triggered what you were going to do for the rest of your career.
So I was not one of those students who came into college knowing what I wanted to do. And I thought I kind of bounced around different majors, undecided for a while. And I thought maybe criminal justice or communications, business, all the kind of the standard things. And then I bought a car. And I bought a car from somebody who was getting their master's degree in nutritional sciences. Wow. And they said, hey, you know what? You should volunteer for in a lab. I work in a lab, and you should volunteer for us. And because I was interested in nutrition, I'd taken a basic nutrition course, which I thought was, this is really good. I like this. I'm learning things very practical. Yeah. And then that in combination with meeting this person who's Gail Welter Coleman. She retired from university a while ago. Thank you, Gail.
Yeah, shout out to Gail.
Shout out to Gail.
Right.
And that's what brought me there. And then once I was as part of that lab, Linda Howe Cooper, who was a faculty member in nutritional sciences, who ended up being on my dissertation committee many years later, she was super encouraging and got me involved in an actual job as a research technician. So I ended up working in the Department of Physiology for a while, and then nutritional sciences. So.
Oh my gosh, that's so cool.
Wow.
Yeah.
So buying a car.
Yeah.
Buying a car.
Paying for our life has to,
What grade were you in?
I think I was a sophomore maybe in college, and so I needed a car, and there you go. It happened to, but that experience, the undergraduate research experience, and that's obviously carried through what I do today, because I do research, and I'm a strong proponent of all of our programs. KEYS being a major one that involves people from very early, but then all of our UROC programs are the undergraduate research programs we have here, so great, and I've met so many great students there. I did not do a formal program like that, but I wish I had.
Yeah.
Because it was so good.
Yeah.
So.
But I think you're right. I think your experience there makes you realize the value of that and really clarifies things for, even if it's in the opposite direction, as you said, with all of these, keys and other programs that are so great, even in high school, and then much less the undergrad, more formal programs. I think sometimes they leave and go, yeah, I hated that, but that's progress too, right?
Knowing what you want to do and what you don't want to do.
Yeah, for sure.
So you were originally a student at U of A, and then you went to other places for, other schooling, and then you came back. So why did you come back?
I came back a lot of times.
Yeah.
I'm a 3-time U of A graduate.
The magnet.
Yeah. The first time I left was because of a nutrition training. And so to become a dietitian, which is I thought I wanted to do that for my career, you have to complete an internship. And the internship is a professional one. It's not related to schooling. And so you have to go somewhere typically because there's very few spots available. And I thought, okay, well, the one I want to go to is somewhere in California because I wanted to leave Arizona and just experience a new place. I applied to a couple of them there and matched with UCSF, which is in San Francisco, and it's a really great medical health sciences campus. That's what their graduate campus, and got super experience in working at the hospital there for the year. So I left, and then I knew I didn't want to live in San Francisco. Wonderful city. So cold. Sorry, everybody.
That's true.
I know that's fake cold because I'm from Arizona, right? It's not really cold.
60 is cold.
But that's what it is all the time. I couldn't do it. But a beautiful area, and I learned a lot. So I'm like, I'm going to come back. And I think figuring out what to do, I still had my connections here from working as an undergraduate student. And so there was a space for me as a research coordinator. And I'm like, I'm just going to work for a little bit and figure out what's next. So, and that was the first time. And then I decided to get my public health degree while I was here, because I thought I need to branch out and figure out what I want to do and learn about things, and public health was important. And then ended up staying for my PhD for various other reasons. And then I left again the second time. I went to do my postdoc at Baylor College of Medicine in Houston, which is the biggest medical center in the United States, I think, Texas Medical Center. And a whole different experience. Worked in a USDA center there, a building with wonderful people, and learned all about behavior and why people eat what they eat and how to motivate people to eat things and not eat certain things. So, yeah, also a great experience. But then, Tucson's my home. I have family here. My husband has family here. We love the outdoors.
Yeah.
So it keeps calling me back. So
yeah. All those things are pretty.
Yeah,
pretty much trying.
Speaking of getting people motivated to eat right,
Yeah.
You've been a nutritional scientist for 15 years. So can you kind of give an overview of your work and what you've done during that time?
Yeah, sure. As a researcher, I focus a lot on health promotion, and in particular, diabetes has been one of the conditions I work on, because it is so directly related to nutrition and to weight management and to exercise and all the things that I've been a part of in my research and in my schooling as well and training. And I've spent a lot of my time working with kids and families, but primarily working in partnership with communities to help them implement programs that help people support health. So I don't deliver them myself, but I work with people like the YMCA, for instance, has been a longtime partner. And right now I work very closely with the El Rio Community Health Center and the Community Food Bank of Southern Arizona, terrific community organizations as well, serving Tucson and all in the areas around us. And those partnerships are really critical to my work because that's who's delivering the things to all the people, and where people are. Yeah. Like people don't come here to do programs. A lot of the time it's very intimidating to come to campus. Yes. We actually have difficulty recruiting people sometimes to studies that happen here. So really glad to be a part of that team. And we truly are partners in what we develop. So I am not the lead. I'm kind of the research lead, but everybody else are experts in their own right. And we work and kind of co-develop things together. So that's how I've spent my time. And a lot more recently is intersected with food insecurity and nutrition insecurity. So happy to talk more about that too.
I would love to, for better or worse, Arizona is one of the most diverse states in terms of population and population health. And, it's always this, especially as a university and as a land grant university where we're trying to make sure that what we're doing is helping our communities and our state. I guess my question is what have you learned? I mean, because even within a small geographical area, Southern Arizona, for example, you're dealing with different types of communities and needs and challenges. What are a couple of things you've learned? I'm sure there's a million, but just some of the things that have stood out that you thought, oh, this is going to work. And for that reason, maybe it was more challenging, and maybe vice versa.
Yeah. Well, first of all, I've learned absolutely keep your agenda in check and at the door, because nobody cares about that, right? Yeah. So I think that they care about what they care about, and they're there at the organization to get a particular thing done, or because they have a need, and that is not my need, and my agenda. So I need to leave that behind. If anything, our partners must be the ones leading. Yes. And what they need and what the patients and clients and people who come to them need is number one. So that's how I approach my work. And if it's not working for them, it's not working for me. It shouldn't be working for me. Right. And so the university, I mean, we have such a wealth of technical expertise here and knowledge and resources that I feel like it's our obligation to lead in that way and really support the people doing that frontline work, and the people who go there. So having not only our partners co-participate and co-develop, but also the people who go to the organization. Right. So we always include the patients and clients and people who are representative of the populations with whom we work in our work, because they're the best position to tell us what they need. Yeah. Yep. It's not me.
Yes. Yeah, so. But I don't think that's not as common a thinking as I think it should be, especially in academia. You're right. We don't know what everybody needs, and that's very refreshing. What has been one of your biggest wins in these community programs? I mean, maybe it's small, maybe it's big, I don't know, but just something that you went, okay, this is making a difference.
Yeah, I think probably our program called FRESH, which is Food and Resources Expanded to Support Health. Very long
acronym, of course.
My student came up with it. Thank you, Eliza.
Good. That's pretty good, though.
FRESH is good. It has a positive connotation. Yes. This is a program we developed with the Food Bank and El Rio over the last maybe 6 years. We've been working on different kind of versions and different studies, mini studies related to this, and now have a National Institutes of Health funded trial that's ongoing, and we'll learn more next year how that's all turning out. But the win there has been the mentions by the leadership of these organizations, by people, by partners, being a part of this, like so invested for so many years, and then patients and clients like saying, hey, I heard about this thing, and can you tell me more about it? So to me, that's great. That means it's not like, oh, we don't want to do that, or no, it's valuable. People are trying to figure out how to make it a sustainable part of the program. Can you prescribe? That's our next step. Can we prescribe this program, which is basically a medically tailored groceries program and nutrition support to patients who have diabetes or who have a diet sensitive condition, and will that help improve their health? And and that's sort of what we're trying to figure out right now. Will it change their healthcare utilization? Right. Will it reduce their financial burden? Will it? There's a lot of questions related to that.
Yeah. That's very exciting.
Yeah, so that's probably one of my the most things I'm excited about, only because of the length of the work, the quality of the relationships we have built up, and the trust kind of in the community. I feel like is really, really rewarding.
Yeah, that's very rewarding, especially living here, for your life. This being your community too.
It is my community.
Yeah.
So you've done past work with El Rio as well. With I think it was familial obesity as well. Can you kind of tell us about that work as well?
Yeah, sure. These were moms at risk of diabetes because of having gestational diabetes. So this is a condition that sometimes people get in pregnancy. It goes away after pregnancy. So when they deliver the child, then it's resolved. But it's a signal, because it means that woman is at higher risk of getting diabetes, type 2 diabetes down the road later in life. And so we know this is a good time to intervene, because people, it's on their mind a little bit, but not only that, but that of their child who was in the womb when they had diabetes, also at risk by virtue of being in the womb exposed to cell signals and glucose levels and things that kind of turn on and off risk in the body. Plus, the circumstances that create extra risk for diabetes can also be environmental. And so the home environment, the community, the family environment are also critical pieces of prevention. And so we thought, okay, family, a base program would make sense. El Rio, this came from El Rio. We have a need we have pediatric clients who are at risk of moms who care, and dads and grandparents who care about this and want to be part of a program. So we, again, co-created this program. And it went on until COVID brought it to a screeching halt. And we finished up as much as we could. We have a paper we published together about it. There's pieces of it that El Rio has taken and used of the curriculum, and ultimately decided not to continue with that particular program, but different versions, and they've kind of integrated some of that in their clinics. So we did learn a lot together, and then we kept working together on this other project I mentioned.
How did COVID kind of halt your work with the community?
All of it was
not being able to go into the
communities at all.
It was probably a good year because we weren't allowed to. So there were a lot of U of A restrictions and human subjects restrictions, but then there's community restrictions.
Yeah.
So
That's true.
El Rio was not allowing people in, and the food bank was not allowing people in. And I work with in partnership with some tribal communities as well through another project. Nobody came in.
Yeah.
Wow.
So nothing happened. It was a tough
A tough time.
And it was actually, it's taken probably the entire time up until now and even now I still feel like it wasn't kind of what it was before, my program. And because I work entirely with
momentum and research is everything.
It really is.
Yeah,
so,
it's tough. It was tough on research everywhere for sure.
Yep.
I'm going to ask a question based on something personal, but I think that your answers can help frame for a lot of people, and that's this idea of, so we're talking about genetics and the familial obesity, and although that was, for a specific population or community, I have some horrific diseases in my family genetically that, we're trying to prevent right now. And I am working with through this, I have to be on a medication, and I'm working with a medical, I don't know what intervention it's something with trying to come up with a diet and nutrition and all of those things based on this medical condition. And I mean, what I'm probably going to say. I have every good intention, and I want to do it, and I know I need to do it. And I come from a very healthy background. I exercise. My mom didn't allow me to have sugar cereal my entire life. That level of insanity. My children had fruit and vegetables on their table from the time they could breathe. So I have the luxury of education and resources around me that a lot of people don't have. So I know the right answers, but it is so hard. Even for me, it is so hard because you don't have time. You just don't have time. You want to, and it's hard. So in a nutshell, how do we find that balance between this extremism that people think about when they think about, oh my God, nutrition, nutrition equals diet. And how do we get to a place where we want to embrace nutrition but aren't so scared because of the extreme feelings about it?
Yeah. Oh, that's a big question.
It is. It is. And not expecting, perfect answers, but I think everybody struggles with that to some degree, that balance.
Absolutely. Yeah. Well, I'll tell you my thoughts in a couple of ways. So one thought, so why people eat what they eat, starting with that, right? Number one.
It's easy.
Convenience.
It's in front of me.
Number two.
I don't know.
It's easy. It's in front of me. Oh, money.
Money.
Cheap. And then what do we think in the top three? What's the third top?
I don't know.
Tastes good.
Yeah, well,
that's true.
Tastes good.
Those are the
of course.
reasons. That's why people eat what they eat. Yeah. Health is way down the list. Yeah. Important, but way down the list. Yeah. And so it's really, I think we have to keep that in mind and go easy on ourselves when we're thinking about that. Another thing, I was at a meeting in Yuma on Tuesday, and we were talking about this very topic there. How do we help people eat healthy and address this convenience and cost thing? And I think you have to make it easy to do that. And you have to make it to have it in your house. You have to, hopefully your family's on board with that too, right?
Yeah, that's the other thing.
Structure your life in a way that helps you kind
of come into meals.
Contact. But it's the environment. It influences us all the time. And so, this is a huge question.
Yeah. I mean, I think that's going to be a big, to make strides in that. I think we're going to, change a lot of health opportunities for people, but that's a huge
and it has to be everything, because I think in America especially, though, things are working against us because of the food advertising, and we have very cheap, tasty, processed foods available all the time. Time poor. We are time poor. We're busy.
Yes.
Yep. It's hard to get
We
home
don't get siestas.
6 o'clock at night, and then, now it's for dinner.
I know.
And so having a plan is really helpful too. But all of this has to come together, and it's hard. I just want to acknowledge it is very difficult.
Thank you. I on that note, we're going to take a quick break, and I think we want to talk to you a little bit about other countries and again, that sort of fight we have, with the United States diet. So we'll be right back.
This podcast is brought to you by a growing partnership at the University of Arizona. The Office of Research, Innovation, and Impact oversees more than $1 billion in research activity. Its communications and marketing team is committed to sharing all the incredible breakthroughs and discoveries, especially the impacts they have on our society. The School of Journalism in the College of Social and Behavioral Sciences is an accredited program with a strong focus on global journalism as well as audio and visual reporting. Students are trained in the latest technology they need to succeed in an ever-changing digital media environment. One example is the internship offered that supports the production and promotion of this podcast. Now back to our hosts.
Well, on our break, we were talking about Tucson being the city of gastronomy and how that makes it even more difficult to keep nutrition in mind. Yeah. But we got to. You were giving us some good feedback of balance and expectations and.
I'm a
living
dietitian.
Life.
I drink beer. We make beer at our house. We brew beer. So I drink beer. I eat donuts. It happens, right? It is not a problem.
That's right.
But I think it's the majority of what you're doing that is really influencing. And so most of the time, the healthier kind of, and that can be tasty too.
Yeah.
Healthy doesn't mean not good.
For sure.
Yeah.
You said that one of the misconceptions was that sometimes people think you're vegan.
Oh,
I know.
All the time.
That is so
funny.
funny. But again, to the extreme views when you say nutrition.
Yeah.
That's what people jump
automatically.
to.
Yeah.
That's again back to that extremist.
And I am careful, so I don't eat a whole lot out, like fast food kind of thing or processed, but I definitely enjoy food. Sure. I eat all the things. I have no restrictions actually with my diet, and so I think it's interesting.
It is interesting. Yeah. Well, maybe that leads us into, I know, another initiative that you're really invested in right now, and with a national connection, and this concept of food as medicine. That's very intriguing to me. Let's talk a little bit more about the vision for that and the partnerships and kind of what's happening with that.
Yeah, kind of on several fronts. So one of them is related to the research I'm doing, since that is medically tailored groceries are kind of a food as medicine program. And I didn't come up with that phrase. That is a national kind of effort going on, trying to address people's risk for chronic diet-sensitive illness in different ways and different intensities. So there's medically tailored meals out there and groceries like what we do. And then there's more health promotion programs that you'll get, if you're a school child, for instance, there's like kind of national health nutrition programs. So all of that's going on. People are trying to figure out, how do you make food a thing you can prescribe to people? Instead of, in addition to, if you need medicine, you need it. But can we reduce people's usage of some medicines? Can we have it complement that in a way that's hopefully more affordable, actually better, healthier, prevent things before we have to manage them? That's all kind of the motivation of that.
I mean, is it, to the point I was just making, if I could pick up my medication that I'm taking to prevent something and also 10 things, 10 grocery items
that your insurance
is on this list of 100 things that I'm supposed to figure out myself.
That's right.
Oh my gosh. I mean, that would be good. That would be amazing. Yeah. That's pretty incredible.
That's a big piece of what we're doing. We're contributing to that part from the evidence base. And then on the outreach and education side, we have a culinary medicine initiative here at U of A that is funded by Novo Nordisk, the pharmaceutical company. And that is helping us partner with Cooperative Extension and College of Medicine Phoenix and the libraries and in our school, Nutritional Sciences and Wellness, we've created an open education resource in culinary medicine, so like a free textbook. We had students co-write it with us, my faculty colleagues. Thank you, everybody. They all hate me now. It's really hard to write a book, everybody. Don't do it.
It is.
All right, so we did it.
That's amazing.
We're at the end. It will be published in January.
Oh, that's
Through
exciting.
U of A Press Books, actually. So there's a free publishing platform that we have a subscription to at the U of A.
That's
I don't know if you know
amazing.
about
I do not,
Yeah.
and I need to. And you need to come back and
I'm happy to tell you all about it. And a shout out to Cheryl Casey, who's our open education resource librarian here.
Very
Awesome
cool.
person. Thank you, Cheryl. So that is happening with our initiative. And then in addition to that, my colleague, Dr. Shad Marvasti in Phoenix, family medicine physician, has offered an elective to medical students for several years now in combination, again, with extension and some of our faculty to help students wrap their heads around nutrition. Because medical students, and actually all kind of, for the most part, health profession students don't get nutrition training, which is terrible. Because they're the ones interacting with all of us when we get sick, or to help prevent some of that, maybe before we get sick. And so that part has been super helpful for those students. We want to kind of expand on several fronts, including other health professions, have an interprofessional exchange, and then rural parts of our state are where we've been focusing some of our efforts, because those are, the medically underserved areas a lot of the time. Many, very much physician shortage, healthcare provider shortages, and still need to know about this nutrition thing too that we're promoting. So it's been a really great experience to have kind of been able to try all that out, and now we want to press the gas on that. So
I love the idea of the curriculum integration. That's a game changer too, because they don't. It's just not, it's physiology and that's it. Yeah.
They get about 19 hours typically. And I think our colleges of medicine hopefully do a little bit better than that. Certainly Phoenix, and I think Tucson as well. I was working on it, but that's a game changer though. Yeah, for sure.
And back to the Food as Medicine initiative, you recently went to DC and met with Admiral Rachel Levine. How did that go? Because your work is going to be implemented.
Very cool.
Thank you. Yeah, I was connected through actually someone living in Tucson is her comms director, Adam Sarvana, and reached out because of our work being featured in the Alumni magazine. So it was a Tucson connection that got me there. But I got to go to HHS headquarters in D.C., right on the mall, and meet Admiral Levine, who's a lovely person. And she interviewed me for just a few minutes about this work, and has actually her office, her being the lead of this, has some nutrition folks who are put together a bunch of resources on food as medicine. So there's a site that they've kind of all these how to measure this, how to think about it, how to kind of have partnerships in this area. And so I was really inspired by talking with her and some of her staffers, because I think our next step as a Food as Medicine initiative is to partner with multiple sectors. So I already, in a way, do that. Work with nonprofit partners and wonderful people, academia. Who else, though? Because it has to be more than us. I'm a very small operation, and even with National Institutes of Health funding, we can't have the scale that we want to have. So that's what our next step is, figuring out who are these partners. What can we do together?
That's amazing. I mean, it just reminds me of, it's probably not exactly the same, but kind of. My sister works for a company that is a fitness maintenance company essentially, but they go into the big companies and Citibank or whatever, and they're not employed by Citibank, but their agreements, their relationships with them allow them to go in and help the employees. And so I mean, that kind of thinking is embedding that thought and that expertise in other areas in businesses or industry or whatever too.
We have complementary things to offer each other, right?
That's really cool.
We wanted to talk about some of the public misconceptions that surround nutrition. So can you kind of
do you have another hour and a half?
Exactly,
hours,
right. Especially with like technology and stuff like that, because you began your career at a time when technology was really taking off. So how does that play a role?
Oh man,
is it helping or hurting?
No.
I was not. TikTok
bad.
Nutrition.
No. TikTok nutrition.
Stop it, everybody.
Oh man, my daughters are right in that range. I'm like,
I struggle with this because look how much reach that people have, which is wonderful. Yet not everybody, but a lot of the influencers or people they have an agenda. They're selling something. They're promoting something. It's a livelihood for them, but in the most kind of sinister social media way possible, which is numbers of people watching,
liking, following,
and that means you have to be kind of provocative in a way that might make you unintentionally, hopefully I'm going to give people benefit of the doubt, exaggerate the benefits of something or other, or overstate things.
Yes.
Because, you know, if it sounds too good to be true, folks,
It is.
It probably is,
It is,
Yeah.
right? It's just not, there's not going to be, a pill or anything like that to solve all the
world's
right?
problems.
There's just not. And you have to
I
exercise.
thought you were gonna end with that announcement.
I'm sorry to disappoint
Dang
you.
it.
Yeah. I've wanted to create a class for a long time that is all about social media and nutrition and kind of like helping people understand how do you
would love that
grind through this
too.
information? How do you sift through this information and know fact from fiction?
Right.
And I used to do a long time ago, coach people who were first starting out running distance, and I did a lot of that for and just listening to first time people, kind of getting out, getting active, and then how to manage their nutrition. There were so many misconceptions. So it really helped me kind of wrap my head around like, so, okay, what do people just starting out on this journey need to know, want to know? And that's our students too in a lot of ways.
Sure.
Too, you know, they're just learning about this. Yeah. How do we give them the tools? The science habits of mind. I feel like it's like some critical thinking in there, and then just some. Where do you go for information? That's a really tough one these days.
Yeah,
you know, we're all in our own kind of bubbles of information, and
Well, and when you seek a source of information online or on social media, you're going to be reinforced with that same source.
Exactly.
Yeah. So
The
I mean, that's
algorithm
going to
takes
be true because that's all you see.
Totally.
So then where should we be looking?
That's a great question.
yeah. I mean, I think seeking out expertise is still the thing. So going to, you know, knocking on the door of the School of Nutritional Sciences. We're here at university.
Yep.
If you're just a person out there who doesn't have ready access, you know, I'd say, I mean, dietitians, there's a lot of groups that are sound information. The government, still good. It's very general, the guidelines that come out of the government and the USDA. Yeah. General, you have to tailor it for you, and that's the part that I feel like that's where the kind of the expertise comes in, that people can help you. But just knowing that none of that stuff on TikTok is generally probably a thing that's going to help you in the long term. Because again, maybe short term, it will. There's a lot of, I could put you all on a specific way of eating that would radically change you probably, you know, in the course of like 6 weeks, 2 months. But then what? You know? So maybe you'd achieve your goal, you know, whatever that is, but then
how do you stay there?
Yeah. And that's the part that I'm interested in, like what happens in the long term?
Yes.
Anybody can do stuff in the short term.
The health versus the weight and the diet.
Exactly.
And
exactly. You got to find something you like. So as far as like diet, you know, eat things that are tasty, right? People eat because it's tasty, convenient, cheap, or affordable. Those are all important factors when you're planning your own diet, or you're not going to be able to sustain it. And the health is definitely should be a priority. I know it's not always for everybody, but if you're active, it's finding things that you like to do with people who are fun.
Yeah.
That's what helps you be active.
Yeah.
Or bundling like your activity with something that you enjoy, like listening to a podcast, for example. So.
Yeah. Well, work-life balance is a good segue because I also understand that you maybe aren't running as much, but you have taken up
very interesting hobby.
Yeah.
For that work-life balance. Tell us a little bit about that outlet.
Brazilian Jiu-Jitsu.
Oh,
so fun.
Yeah. What made that the logical choice after running?
This is a great question. Yeah. So I did run, you know, a competitive amateur for a very long time, distance, half marathon distance, and I walked off the last race, 2019, the course, and I'm like, I got to do something else because I'd been kind of doing it. It was a habit, but my friends had sort of moved off into different things. Some of them went and did ultra marathons. I couldn't join them on that journey. No, thank you. Good job, everybody, but I can't go there. Other people, just injuries, things change, you know? People change and your groups change.
And unfortunately, we get older.
And that happens as well. Exactly. So I thought, I need something else. So I was talking to a colleague because I thought this would be a good time to do self-defense. It's something that I always thought about. I'm like, oh, you know, I'm a woman in self-defense, and you always kind of hear that message, but what does that really mean? And so I was talking to Parker Anton, who is a colleague in Yale, who has a black belt in judo and is very much a martial artist. And I said, what do you think I should do? And he's like, oh, I think you'd like jiu-jitsu, and here's the person you should go talk to. And so I went to the school, and I had no idea what it was. I showed up on day one, and I'm like, what is this? Oh wow, this is a lot different. This is, you know, it's submission and grappling. So you're wrestling people
Wow.
and trying to choke them out or break a joint. That's like the end game there.
I may be getting the name of your
Happy to recruit anybody. Yes. And so I just really enjoyed it, and it's the puzzle of it. So this is a very long-term sport, kind of like academia. It takes a long time to be proficient, like decades, decade or more. Yeah. And it's a puzzle. It's like chess, because what you do is in response to your partner. And it's always different, even though you know techniques and there's concepts and and rules, but it's very much a different game every time you go and train. So it's great. So I train at Sonoran Brazilian Jiu-Jitsu in Midtown.
Nice. Y'all shout out to that as well. Yeah.
So
that's very cool.
You've been doing it for 4 to 5 years now. Yeah. So you're kind of like at an intermediate level. Do you have any favorite
Approaching
moves?
Intermediate.
Or any favorite techniques?
No.
Would you like to show us?
I can show you. Come over to Sonora. I'd be happy to. No, not really favorite techniques, but I just love learning. I think that's why I'm here. All of a sudden, my job.
I was gonna say it does sound like that's your work-life balance is. It still involves your brain and the way that you need to process. But
some of my coaches have been like, put that aside. It's good that you know a lot of stuff, but now you got to, the practice part of it is what makes you proficient at it, right? Sure. So the doing of it. And I just love that I go there and I get to see my friends and then just have a fun time for an hour and a half and not think about anything.
Well, you can't, right? You have to be
so
in that
consuming.
Moment. Yeah.
So I think, and then also the other cool thing about jiu-jitsu is that you can, you train with people who are all different sizes, men and women are in there, and some people are very large, and you could still do a move, and in some ways, you're kind of equivalent.
Yes.
Because if you know the technique and you're doing it correctly, and so that part's really fun. It's really great.
Good for you.
Yeah,
I think,
incredible.
But all joking aside, it makes all the difference when you find something that you can just leave all the stress for a minute at the door and focus only on that.
Yep.
And that's really,
great.
Really important. So, I think, this has been amazing. I thank you,
my pleasure.
for doing our Thanksgiving edition.
Special episode.
Thinking a little bit about nutrition, but also pumpkin pie. And I think I want to end with a question. We're kind of trying to ask everybody. We know science, research, innovation is so much about curiosity and creativity and wonder, if you will. And that's so prevalent here at the university. I've been really lucky to meet people for all these years that, the brain, their brain is just amazing because you're always wondering and you're seeking. And have you had, as you've been through this, just some aha moment that has happened to you? As you've pursued some idea or some dream, or you've just gone, now I understand why, I've been doing all this.
Maybe not so much about the questions that I'm investigating, which are always fun and interesting to me, but more about the process. And then when I was first starting out, I was really worried about being a researcher, and this is a common student question that I get to, or concern, is that, well, what if I don't have any other ideas? Like, what am I going to do next? How do you, how am I advancing science? Because there's so many science people out there, right?
And that statement is so big. Advanced science.
Yeah, and I was so nervous about that. And then I realized finally, oh no, things, it just happens. It kind of flows. Like you meet people, and it's about meeting people.
Exactly.
Yes.
Working on a team,
Connecting,
collaborating, putting yourself out there in that way, but I just love meeting people and understanding what they get excited about too.
Yeah.
Me too.
So that's what I find is like the aha is like, oh, it's not really about me trying to rack my brains in the corner in a dark room, all by myself. It's about talking to people and bouncing ideas off of them and learning what is important for them, and then also what can they do that is complementary to what I do. It's not about one person, one lab.
No, never is.
Exactly.
Never is. I love it too when you say, or somebody around you says, my team knows this about me. My favorite line is, I have an idea. And literally the best thing in the world is when, something actually comes of that worthwhile. Not for you, but that is meaningful for some other purpose. And that's one of the best things about working in a university, I will say, is you can, as long as you're willing to do it.
And the students are also the best, and that's why I'm here too, because they contribute so much to what we do.
Oh my gosh.
And the research.
We couldn't do it.
We
couldn't do anything here without them.
Yeah.
Well, thank you,
Thank you
Laine.
so
That was
much.
fun. Yeah, really, really nice talking to you, and we appreciate all you do here. And
Thank you.
we
Same to
will
you guys.
reach out for some more tips and
Yes.
tricks.
Yeah,
and,
please do, anytime.
Yeah.
For sure. Yeah.
Well, thanks, Melanie.
Thank
We
you so
appreciate
much.
it.
Of course, yeah.
Thank you so much for joining us for this episode of Wildcat Wonder, the podcast where we take you inside Arizona research. If you enjoyed what you just heard, just send it to a friend, colleague, or maybe share it on social media. Remember to follow the Office of Research, Innovation, and Impact on your favorite platforms. And if you have a good suggestion for a person or a project to feature on an upcoming episode, email research@arizona.edu. Bear down.